So right now we're having a little bit of an uptake, but we're getting, things have stabilized somewhat. Um, Hospitalizations were down. Now we're starting to see them rise a little bit. We don't know where that's going to go, but it's been such a challenge here because, um, you know, we were just not prepared for this in the United States. They had some kind of a federal resource that was supposed to have a lot of emergency PPE. And, when they brought that out, it was, gloves that were child size or, torn gowns. There was just not enough. And then there was the problem with shipments getting stolen because all over the world we were all going through the same thing. So, hospital buyers would show up and there would be no shipment because it would go to the highest person who, came and offered the most money. And, at one point we were reusing PPE, we were getting sick. And, we never knew if we were buying, we were buying raincoats off of Amazon, stocking up on garbage bags because we just did not know from one day to the next what we would have to be able to take care of patients. At one point, we were working in precaution gowns that were made out of airbags that Ford Motor Company had somehow made for us. But of course, a lot of us are petite women, and we had these big, heavy vinyl extra large gowns that came down to our feet and, didn't fit properly, didn't wash well. And, it was a struggle all around. And certainly the ICU bed issue, our union the first time around had a lot of difficulty trying to come up with an agreement with the administration. We basically came up with our own plan. We had recovery nurses who made a makeshift ICU with extra beds in it so that when we had those extra ventilated patients, we would have a place for them. And we had nurses who were ICU nurses that, went to different specialties, and they just basically all pulled together, worked all different shifts that weren't even their own shifts to staff this ICU, this makeshift ICU plus our ICU proper. And it was, basically nurse driven because there was just no agreement. Management and administration was very reluctant to come up with any kind of, we wanted proning teams, we wanted extra help to try to turn these patients so they could breathe. And, it was a struggle that way, and also having a struggle of actually caring for the patients. So it was kind of like a double-edged sword there. We also had, we were on the med surg floors, we were caring for patients we had never cared, in acuity wise, caring for patients that really were more ICU level patients. That was difficult, exhausting. The one thing I can say is that we have a pretty tight community. We do have our hospitals in the city, but the community was so great pulling together for us, sending us cards, and they'd send us in meals because they knew that we were working extra hours and everything. But it was not a well planned out response to the pandemic, in my opinion.